Hi everyone, this is Dr. Navneeta Kapoor from Mind is in Charge, Not the Body. It's all about health awareness about everything, but in my way, and it's absolutely free for everyone. I'm on Facebook in English and in Hindi, on YouTube for my English and Hindi videos. I'm on Instagram, WhatsApp, Telegram, even on TikTok. Well, if you go into Google and type in Mind is in Charge, Not the Body, you'll find me and all the links. Today, I wanted to ask you something. Do you ever get attracted to the opposite sex even when you're in a relationship with someone else? Or perhaps you probably might be thinking of a one-night stand might not hurt. Well, I ain't judging you, but just to make you aware that there's so many sexually transmitted diseases out there. The most common ones to look for is chlamydia, or gonorrhea? How about syphilis or herpes and HIV or HPV, which is caused by the human papillomavirus? Well, what are the symptoms then? The symptoms might be painful urination or a burning sensation or even a smelly vaginal discharge or even vaginal bleeding. Sometimes there might be no symptoms at all. And what could be the probable risk factors then? Well, unprotected sex, multiple sexual partners, prior history of sexually transmitted diseases, or alcohol and drug abuse. Or it could be that you're simply young and experimental. Well, you'll be surprised to know. We all know that prevention is better than cure. So maybe condoms is the answer. But there are loads and loads of myths and facts which are around condoms. A myth is condoms have manufacturing defects. Well, the fact is that condoms are qualitatively tested by the FDA to ensure that there are no holes and there will be no leaks. Another myth about condoms is that condoms don't even protect against sexually transmitted diseases. Well, the fact is that most of the sexually transmitted diseases are preventable by using condoms. Diseases like chlamydia, syphilis, gonorrhea especially. One myth about condoms is that the size doesn't matter, but if it's the correct size, the condom will definitely be more effective. Some people think, which is a myth, that two condoms might provide better protection. But the fact is, if you use two condoms together, it may cause more friction and there's more chance of tear and there's more chance of a leak. Well, another myth is that condoms don't even protect against pregnancy. Well, condoms, when used properly, then they prevent against pregnancy. Now, what about HIV then? Well, HIV is mostly spread through people who are having unprotected sex and who already carry this infection. Or it could be spread by sharing needles with people who have HIV. And it is passed through infected blood, semen, or vaginal fluid, which people who have HIV and people who come in contact with them. Well, HIV is not spreaded by hugging and kissing and by sharing cutlery or by using somebody's clothes. So, what are the most effective birth control then? There could be short acting, long acting, and there are various barriers of protection. Short acting ones, well, provides a contraceptive plan for a short period. Like, say, for instance, if someone is family planning, or they could use a patch, or they could use a vaginal ring, or maybe a injection to prevent pregnancy. Long acting, on the other hand, is intrauterine devices or some contraceptive implant or even copper T. And there are various barriers of protection like a cervical cap, a male or female condom, a diaphragm. Do you know that there are dental dams as well, which can be used for safer practices of sex? Now, think about it. It's entirely up to you. Don't get it, but if you do, then get it checked out. Your doctor is the only trained person around who can investigate. He can find out that you're carrying something, and if you are, then there is treatment. But if you get human herpes, then there ain't a long-term treatment for it. But yes, the bouts and the spread can be controlled. So think about it. Better safe than sorry. Better to be smart than to be casual. It's entirely up to you. Goodbye and good luck.